Hi there, I'm Jacqueline Warshauer, and I'm the National Director of Medical Review and Quality Services at Aegis Therapies.
And I'm Mary Saylor. I'm one of the medical review and denials managers, also with Aegis Therapies. We'll be doing a session on maintenance therapy at NARA's upcoming fall conference in Las Vegas.
Maintenance therapy has been around for some time, but it can still be a challenging topic to fully understand and embrace. I think we can all agree that providing clinically appropriate care to our patients is the right thing to do, but many of us are hardwired to think that, as therapists, we need to always be working towards getting people stronger, safer, and functionally independent. Many find it challenging to adapt to developing therapeutic plans where no progress is anticipated. Other therapists may be quicker to adapt to the possibilities and benefits associated with maintenance therapy, but aren't sure how to execute it the right way.
Take a moment and consider your level of confidence answering these questions. What is maintenance therapy and who can provide it? How are documentation expectations different from our typical rehabilitative services documentation? How do I determine if my patient is appropriate for maintenance therapy, and how or when do I start the program? If any of these questions were challenging, we can help. These and many other questions will be answered during our session, Maintenance Therapy Jitters, Understanding Right Place, Right Time, and How to Document Maintenance Appropriately. Please join us and bring your questions. We'll see you in Vegas.